So STI stands for sexually transmissible infection. We used to call them STDs, but now we call them STIs. And they are exactly what they sound like. So they're infections which are transmitted by sexual contact. They're either viruses or bacteria. And the commonest STI, the one that we've all heard of course, is chlamydia, which is a bacterial STI. The key thing with STIs is that we do know that many of them are actually silent. So that means you've got no symptoms. So what we need to say to people is that if you've had unprotected sex with a new partner, you could have an STI without even knowing about it. So you do need to go along to your doctor or family planning clinic to get tested, even though you've got no symptoms. We know that certain STIs are certainly increasing, and chlamydia, as we know, is the big one. Now it's increasing absolutely in young people, but we need to remember that it's still, it doesn't discriminate on the basis of age. So, people of all ages, older people who are in new relationships can potentially get STIs as well. The main thing is to get along to your doctor. It might be your GP, you may want to go to a family planning clinic, sometimes to a sexual health clinic as well. And it's all about communication. Don't be afraid to talk to your doctor. We've heard it all before, so you won't be judged. So go along, talk to your doctor, talk to the nurse that you see, and then what they will do, if you've got symptoms, then you'll be examined. But don't be scared about that. But if you have no symptoms, then generally what happens is we'll ask you just to give us a simple urine test. Okay, so just a simple test. Sometimes we'll get women to take a swab themselves as well, just what we call a self-collected swab. So the testing is very simple, and we know that people can feel a bit nervous sometimes that it's going to be a bit invasive and they feel worried about it, but please don't be worried about it. It's very straightforward. Protected sex means that you've protected yourself against STIs, and what we're talking about here is using condoms, of course. So it's very important to know that there are different types of condoms. So if you've been into a local pharmacy or chemist lately, you'll see the huge array of male condoms. They come in different shapes and sizes and colours. The whole thing around STIs is communication with your partner, communication with your doctor or your nurse if you are concerned about the fact that you might have contracted an STI. But you do need to be able to talk to your partner, and if you are diagnosed with chlamydia, what we do, we call it contact tracing. It sounds a bit sterile and a bit serious, but it's a simple thing. What we want to make sure is that the partner is treated at the same time as well, and that stops that infection, ping-ponging backwards and forwards between the couple. What we don't want to do is treat the female partner, the male partner's not treated, and then gives that back to her. So, or vice versa, of course. So, because it's always a shared discussion. So both partners need to take responsibility.